Have you ever done something your doctor recommended, only to wish later that you had asked more questions first? Maybe it was a scan, a test, a biopsy. You were told it was just routine. But what followed wasn't so simple. For many older adults, especially after retirement, medical screenings that were once helpful can become stressful, invasive, and in some cases, regrettable. Today, I want to gently share with you the stories of real seniors who've experienced this firsthand. Their experiences can help us all make more thoughtful, informed choices about our health. This isn't about blaming doctors or saying screenings are bad. It's about understanding the full picture, especially after age 65, when the risks and benefits start to change. Point 1. Carol's story. The thyroid nodule that led nowhere. Carol was 72 when she got a full body scan through a wellness program at her gym. She felt fine, just curious. The scan showed a tiny thyroid nodule. It wasn't cancer, but that one harmless find launched a year of tests, 2 biopsies, an ultrasound every 3 months, even surgery to remove part of her thyroid just in case. She lost sleep, lost weight, and in the end, her doctors said it probably never would have caused a problem. Carol now says, "If I could go back, I wouldn't have done that scan. It made me a patient when I felt perfectly healthy." Her experience shows us that some findings don't need fixing, especially when they're unlikely to affect your life or health. To Frank's story, the PSA test that triggered a chain reaction. At 76, Frank still worked part-time and played golf twice a week. His doctor offered a routine PSA test, a blood test, to check for prostate cancer. The number was slightly elevated, which can happen naturally with age, but that led to a biopsy and an infection from the procedure, followed by medication, side effects, and months of discomfort. The kicker: his cancer was so slow-growing, they decided not to treat it. Frank told his daughter, "I wish I'd known this was optional. It ended up doing more harm than good." For many older men, PSA screening is no longer routinely recommended after 70, because the risks of overdiagnosis often outweigh the benefits. 3. Susan's story. The colonoscopy she didn't need. Susan had her 3rd colonoscopy at 74. Her previous 2 were completely clear, but her new doctor insisted on staying on schedule. This time, something went wrong. The prep dehydrated her. She fainted at home, ended up in the ER. The colonoscopy showed nothing again. "I thought I was being responsible," she said. "Now I realize I should have asked why it was necessary." Current guidelines suggest stopping routine colonoscopies around 75 if you've had a history of clean results. But many doctors keep ordering them out of habit or caution. Susan's regret, not the procedure itself, but not knowing she could say no. For Walter's story, the lung scan that created more fear than answers. Walter, 79, was a lifelong non-smoker, but during a checkup, his doctor mentioned a low-dose CT scan for lung cancer. Out of curiosity, Walter agreed. The scan found a spot, likely scar tissue, but now he needs regular follow-ups. Each scan brings anxiety. Each result means waiting for days. His life, once calm, now revolves around what-ifs. No one told him how often these scans pick up harmless findings, or that false positives are more common in older adults. Walter now says, "I wasn't worried until the test gave me something to worry about." 5. Barbara's story. The mammogram that changed everything. Barbara was 76. When a mammogram found an early-stage tumor, her doctor called it a lucky catch. But what followed was months of surgery, radiation, side effects, and fear. Looking back, Barbara says, it might have extended my life, but it also took away a year of joy. She wonders if, at her age, monitoring would have been a better choice, one that preserved her energy and peace. Breast cancer screening is a complex, personal decision in later years. Barbara's story reminds us there's no one answer. 6. The common thread, the missing conversation. What unites these stories isn't the screening itself. It's the lack of a full, honest conversation beforehand. No one explained the odds of harm, the likelihood of false alarms, the impact on their day-to-day life. Each of these seniors believed they were doing the right thing, but they weren't. Told that the right thing depends on age, health, goals and personal values, what they wish they'd heard. Let's talk about whether this test is right for you. That one sentence could have changed everything. So what can we learn from their stories? First, ask questions before agreeing to any screening. What are the chances this will help me at my age? What are the risks if we don't do it? If it finds something, what happens next? Second, know that it's okay to say no. You're not being reckless. You're being thoughtful. And finally, trust your instincts. If a test doesn't feel right, if your body is telling you to pause, listen. Medicine should serve your life, not steal it away in worry in waiting rooms. Have you ever had a test or procedure you later questioned, or learned something from a friend's experience? Please share your story in the comments. It might help someone else feel less alone. And if this video helped you, please like, subscribe, and share it with someone who deserves a little more peace. In their healthcare journey, you deserve care that's not just fast, but kind, wise, and fully yours. Thanks for watching and take good care of yourself.